Kathy demonstrates useful skills to make an appointment for professional help regarding her situation. She is prepared with her calendar and her questions.
Hello?
Hello, I'm trying to reach Dr. Benight to set up an appointment.
This is Dr. Benight. How can I help you?
Well, it's kind of difficult to talk about, but I think it would be good for me to talk to someone about something that happened about a month and a half ago.
Okay. I'd be happy to meet with you. It might be good if you could tell me a little bit about the general nature of the problem so that I could see if I'm the right person to help you.
Well, about a month and a half ago, I was involved in a traumatic experience that I've had a really hard time getting over. I'm having a hard time with troubling thoughts about the experience that really get to me. I'm not sleeping as well as I used to, and I just feel like I'm not myself.
I think it is good that you've called. Some traumatic experiences can be difficult to manage. Therapy can help to figure out ways that you can get through this and move your life forward.
I understand that some therapists or counselors are trained specifically to help people with trauma. Do you have that kind of training?
Great question. Yes, I am trained in a specific trauma treatment called cognitive behavioral therapy, as well as a technique called EMDR. Both of these treatments have solid scientific support for their effectiveness.
Oh, great. I guess the next question I have is, how long does this type of therapy take?
Well, it all depends, but usually we can see some benefit within a few weeks to a month, or about 3 to 5 sessions. Each session usually lasts about 50 minutes. Now, most trauma-related therapy lasts between 8 and 15 sessions. This doesn't mean that you'll need all 8 or that you might not benefit from more than 15. It all depends on your particular situation.
Okay. I was also wondering, how much does all this cost?
Most health insurance plans will help to cover the cost with a copay amount and up to a certain number of sessions per year, usually about 20 per year. Yet your plan might be different, so you ought to call your insurance company and ask specifically about your behavioral health coverage. But if you don't have insurance, the rate that I charge is based on a sliding scale and depends on how much you can afford.
I do have insurance, so I should call my insurance company first?
It would be good to just check on your coverage. There might be a list of service providers that you're supposed to use.
Oh, yeah, I do have a list. That's how I got your name.
Oh, perfect. Would you like to set up an appointment now?
Yeah. How about next Wednesday, the 18th? Do you have anything open around like 4 p.m.?
That sounds fine. And what is your name?
My name is Carolyn Lyons.
Okay, and your contact information?
At home, would that be okay?
That would be great.
Okay.